Well, good morning, ladies and gentlemen, and please be very welcome to the 44th World Hospital Congress, co-organized by the International Hospital Federation and the Catalan Union of Hospitals. This edition, we are working under the motto, People on Board, transforming healthcare by blending agility, responsiveness, and resilience. My name is Helena Canadell, and I'm thrilled to be your presenter for next 3 days. Today, we kick off the first post-pandemic Congress and brings together experts, heads of health systems, and health organizations responsible, having the commitment to seize the opportunity to accelerate the transformation of health systems in order to provide better answers to needs of care for people. The 44th World Hospital Congress is finally a reality here in Barcelona, having all of you face-to-face. So within next 4 days, we will place Barcelona and Catalunya as world's benchmark in health. And we will do it from here, from Pere, Barcelona, with more than 1,500 face-to-face and online attendees from more than 70 countries, around 5 continents. For the first time, the Congress is held as a hybrid event, which multiplies the possibilities to share and reach world leaders. So, again, special greetings to all those who are following us from more than 300 virtual hotspots around the world. Within next 4 days, we will enjoy and learn with more than 300 speakers, 80 sessions, and more than 1,000 abstracts presented. So thank you for the trust. We therefore give the official start to the Congress with the authorities and organizers of this 44th Hospital Congress. First of all, I would like to thank and welcome the most excellent mayor of Barcelona, Ms. Ada Colau, the President of the Generalitat de Catalunya, the Most Honorable Mr. Pere Aragonès, who sent us a message, and we will be able to hear it later on. Both Generalitat de Catalunya and Barcelona City Council are the institutional partners of this Congress. We'd also like to thank the organizers and the promoters who made this Congress possible. On one hand, the President of the Catalan Union of Hospital, Mr. Enric Mangas, the Commissioner of the Board Directors of the Union of International Affairs, Mr. Jaume Duran, and the President of the International Hospital Federation, Dr. Risto Miettunen. After this institutional part, we will go ahead with a scientific opening led by Dr. Trilla, chair of the 44th World Hospital Congress Scientific Committee, and Mr. Víctor Grifols-Deu, CEO of Grifols. Last but not least, Dr. Hans Klug, Regional Director for Europe of the World Health Organization, will provide a keynote address. So let's start, and let me give the floor to the Mayor of Barcelona City, Ms. Ada Colau. Good morning.
Good morning. Dr. Miettunen, President of the International Hospital Federation, Enric Mangas, President de la Unió Catalana d'Hospitals, Jaume Duran, comissionat de la Junta Directiva d'Afers Internacionals de la Unió Catalana d'Hospitals, amics i amigues, dear friends, authorities, good morning, bon dia. Us agraeixo molt que m'hagueu convidat en aquesta inauguració del 44 Congrés Mundial d'Hospitals. Per Barcelona és una oportunitat magnífica i és simbòlic que un dels primers congressos presencials sigui precisament el del Congrés d'Hospitals i centrant-ho en la sanitat, que és precisament el que ha travessat les nostres vides amb la crisi de la Covid durant aquests gairebé 2 anys. As Mayor of Barcelona, it's a great pleasure for me to welcome you to our city. Thank you very much for choosing Barcelona to celebrate this important event. I would like to begin my speech by thanking you all. All of you have had to deal with extreme situations due to the COVID pandemic. Thank you very much for all your effort and commitment trying to save so many lives facing such an unknown disease. Preciously, during the health crisis, we have been able to see even more the importance of having a strong health system and hospital sector. And of course, also the importance of not leaving anybody out of it. Health is a universal human right, and we have the responsibility of guarantee that nobody lost their health for not being able to pay for it. This commitment made us put all our resources into adapting to the growing needs that the pandemic was causing. The collaboration among public institutions, hospitals, and social sector made possible what seemed impossible, such as creating hospital wards in municipal sports centers in only 4 days, and obviously for all the people who need it. For Barcelona, health public service is essential, and that's why we go beyond our competences when it's necessary. For example, we have created a public dentist service, which is not covered by the national public system, and also a public psychology service, especially thought for teenagers and young people who are having more psychological problems nowadays. People's needs go first. And the importance of the health system is going to gain more importance from the current context of climate crisis, which we know for sure is already causing serious health and mortality problems around the world. And also from the care and social crisis produced for the aging. The health system must be aware and prepared for all these challenges. Finally, healthcare facilities and professional practice must also face the importance of a humanistic and comprehensive view of the person's context. The health system and its organizational model has to place people's needs and well-being at the center. The fact that humanization of attention is part of the debate of this Congress is very good news, I think. We want Barcelona to be a caring city, and that means putting the right to care and to be cared in everything that happens in our city. Finally, I also congratulate you for incorporating in the Congress the approach to a change in the leadership model, which promotes ethical leadership and women's leadership. I'm sure they can help a lot in meeting the challenges ahead. Sara Berbel, the Chief Executive of the Barcelona City Council, will make a speech in a few minutes about it. I'm convinced that the debates and conclusions you will reach during this Congress will allow us to move forward in building a healthier, more human, and fairer world for all. Again, welcome to Barcelona. I wish you a fruitful Congress and enjoy your stay with us. Thank you.
Thank you very much, Mayor. Let's continue with the presentation of a World Congress promoted by the International Hospital Federation that has a long history. It has its origin in the first International Hospital Congress held in Atlantic City back in 1929, and the first biennial, and since 2016, with annual continuity and is organized jointly with one of its members. The Catalan Union of Hospitals, a full member of the International Hospital Federation, presented and won the candidacy to organize the 44th World Hospital Congress in Barcelona back in November 2020. But, as you know, the COVID-19 forced to postpone it for a year, so today, finally, it's a reality. International Hospital Federation and the Union and all the organizations that are part of it, are committed now more than ever to promoting, sharing, and advancing the changes needed to improve the health and well-being of people. Now, it's time to give the floor to the President of the Catalan Union of Hospitals, Mr. Enric Mangas, and, of course, to the Commissioner of International Affairs of the Board of Directors to the Union, Mr. Jaume Duran. The floor is yours. Thank you.
Bé, doncs, excel·lentíssima alcaldessa de Barcelona, de Colau, president de l'EXcma, Risto Miettunen, Com sabeu, el molt honorable president de la Generalitat de Catalunya, el senyor Pere Aragonès, no el tenim avui presencialment amb nosaltres, però ens oferirà uns parlaments al finalitzar l'acte. Així mateix, em plau donar la benvinguda al doctor Antoni Trilla, president del Comitè Científic del 44è Congrés Mundial d'Hospitals, al doctor Hans Klug, que és el director regional europeu de l'OMS, i al senyor Víctor, codirector general de Grifols i principal partner d'aquest congrés. Com no podia ser d'una altra manera, benvingut també als quasi 1.200 professionals que ens acompanyen aquests dies a la Fira de Barcelona i a més de 300 professionals que esteu connectats des de 60 països arreu del món. Tots vosaltres sou veritables protagonistes d'aquest congrés. Com a president de la Unió Catalana d'Hospitals és un honor inaugurar aquesta trobada mundial que organitzem juntament amb la International Hospital Federation, un fòrum de reflexió i debat que precisament té com a timó millorar l'atenció a les persones i fer-ho amb una mirada al futur i obert al món. Aquest és un lema de la Unió que, com sabeu, l'any 2019 vam posar en marxa i és l'ADN o forma part de l'ADN de la nostra organització. Per arribar fins aquí hem comptat en tot moment amb la col·laboració i complicitat de la Generalitat de Catalunya i l'Ajuntament de Barcelona. També vull traslladar un especial agraïment i reconeixement a l'esponsor principal, Grifols. Des de l'inici ens ha ofert la seva confiança i ens ha donat suport fins al tot en els moments més fràgils de la pandèmia. Recordeu que teníem que fer aquest congrés el 2020 i malauradament no va estar possible, així com a 3 partners principals també, que són Boehringer Ingelheim, Medtronic i Palex, que la seva estimada col·laboració ha fet possible aquest congrés. Volem també fer valdre també la nostra gratitud als 25 sponsors, als 12 partners de coneixement que ens han contribuït a fer créixer la qualitat científica del congrés i a les 19 empreses que ens acompanyen amb el hub d'innovació a l'àrea d'exposicions. Una suma de talents que avui compartim amb aquest espai de la Fira que ens ha brindat com seu del 44è Congrés Mundial d'Hospitals, unes instal·lacions en les quals ens sentim del tot acollits i recolzats. Tot plegat tenim el repte d'avançar cap a la transformació dels sistemes de salut i per vetllar per una major humanització de l'atenció, amb un abordatge integral, sanitari i social i sobretot en benefici de la ciutadania. En definitiva, hem de contribuir a millorar la salut de les persones i a revertir les desigualtats que han deixat la Covid-19. Al llarg d'aquestes jornades tindrem l'oportunitat de trobar respostes comunes des de vessants més científics, mitjançant un programa i unes ponències excel·lents. En aquest sentit, agrair l'encomiable tasca duta a terme pel Comitè Científic del Congrés, que en tot moment ha treballat per oferir i compartir solucions innovadores amb el partenariat i el teixit empresarial, sempre sota l'eix vertebrador del compromís social. D'altra banda, des de la Fundació Unió també hem volgut acompanyar aquest congrés d'un acte solidari a favor de la salut mental, el concert en benefici de la Marató de TV3 i Catalunya Ràdio. Per fer-ho possible, hem comptat amb el suport de la Fundació La Caixa i la companyia farmacèutica Lundbeck. Us animo a que compreu entrades que encara hi ha disponibles pel concert que celebrarem demà amb el Palau de la Música. Una iniciativa que compta amb el suport i difusió i el prestigi de la Corporació Catalana de Ràdio i Televisió. És per això que, com a president de la Unió Catalana d'Hospitals, em sento molt agraït per inaugurar avui aquest 44è Congrés Mundial d'Hospitals, una oportunitat de la International Hospital Federation en la que em sento molt honorat. Espero molt sincerament que aquests dies tots plegats compartim, aprenguem i gaudim i sobretot contribuïm a fer que la salut esdevingui un eix estratègic global. Com a país, com a món, hem de tenir cura de les persones, la nostra raó de ser, però també hem de ser capaços de generar ocupació estable, creixement d'alta qualificació, impulsar la recerca i la innovació i fer de tractors sobre el conjunt de l'economia. Durant aquests 4 dies, Catalunya i Barcelona es posicionaran com a referents mundials de la salut, una fita històrica després d'una pandèmia que ens ha sacsejat a tots. Per últim, novament donar-vos les gràcies perquè ens acompanyeu durant aquests dies de reflexió i, en tot cas, donar la paraula al comissionat d'Afers Internacionals de la Junta Directiva de la Unió, el doctor Jaume Duran.
Morning. Morning, everybody. Molt honorable President of the Generalitat, Illustre Mayor of Barcelona, President of the International Hospital Federation, President of the Unió, authorities, representatives of various institutions, partners, speakers, friends, and colleagues, each and every one of you. A very good day to you all. Welcome to the 44th World Hospital Congress. I want to join the President to welcome you on behalf of the Unió. Thank you for your presence to those who have been able to travel to Barcelona, and those colleagues and professionals who are joining us from their respective countries remotely. We hope this hybrid Congress and experience, both virtual and face-to-face, can be shared by all. This is a long-awaited event. We have overcome many challenges and difficulties to make it possible. Originally planned for 2020, right in the middle of the preparations, the coronavirus pandemic struck, and it's still affecting the event this year. Healthcare systems across the world were required to put all their efforts into fighting each new wave of COVID-19 and its consequences. All professionals, healthcare organizations, citizens themselves, and healthcare managers and politicians have stood together to fight against this unprecedented scenario. The 44th World Hospital Congress already aimed to focus on the transformations healthcare systems need. It wanted to anticipate the challenges facing us: technological transformation, new professional roles, the role of citizens in healthcare systems, and the new values. In the summer of 2020, the Congress was postponed, but Barcelona remained the chosen location, and the main theme of the Congress also stayed the same: leading the transformations in our healthcare systems, including now the experiences and teachings from COVID-19. Today, more than ever, we are all responsible for pioneering brave transformations, more universal and more sustainable assistance models, and a greater response capacity that proves to be more agile and resilient to continue improving people's quality of life. The world has managed to work its way out of this global crisis, and we are moving ahead. However, we are still facing the same future challenges: demographic shifts, climate change emergency, many economies in crisis, technological revolutions, and a global war that turns epidemics into large-scale pandemics. It's precisely when facing difficulties and challenges that we can discover great opportunities. The opportunity to adhere to the COP26 pledge to reduce our global warming. The opportunity to transform science that advances knowledge and improves citizens' services. Opportunity to realize that people's health cannot be seen merely as a national expense, but as the best way to invest in our future and also in our present. And finally, to emphasize the value, skills, and commitment of the professionals who make it possible. The scientific committee, led by Dr. Antoni Trilla, has worked hard to organize a Congress with high quality, up-to-date content. This is illustrated by the importance of the speakers and the support from the European Office of the World Health Organization, represented by Mr. Hans Klug, whom we would like to thank both his commitment and presence here today. I would like to take this moment to make a heartfelt and very much deserved mention to all the professionals in our healthcare and social systems, without any exception. Their effort, dedication, and commitment has been, is, and will be an example to the whole world. For many years, International Hospital Federation has worked to ensure that a solid network of entities around the world is kept alive. However, this time, its support and commitment to learning and the specific situation in each place around the world has been exemplary. Thanks, International. La Unió represents most of the entities in the healthcare and social system in Catalonia. More than 100 entities, more than 750 centers, and many, many partners. We have different origins and ownerships with more than 65,000 professionals. Our entities have diverse backgrounds and experiences, but they all share the passion to offer people a high quality, responsible services, committed to supporting our society. La Unió is moving for people, has a worldwide vision, and has been serving society for more than 45 years. Today, we are pleased to be in Barcelona once again. This is an exceptional capital city in a beautiful and resilient nation. It's always made stronger by difficulties and accepts challenges bravely, seeking the best response to ensure its people's happiness in a just, free, and supportive way. So, please enjoy this Barcelona Congress wherever you are. Enjoy sharing experiences, knowledge, and good practices. And may your time here impress on both you and us the need to improve the world healthcare. Thank you very much.
Thank you very much, Mr. Duran. Also, thank you, Mr. Mangas. And now, let me give the word to the President of the International Hospital Federation, Dr. Risto Miettunen.
Thank you. Honorable Mayor, dear Presidents, friends and colleagues, ladies and gentlemen. It is my great pleasure on behalf of the IHF to welcome you to this 44th World Hospital Congress. This Congress was supposed to take place 1 year ago, but hit by the corona pandemic, we had to make arrangements to postpone the Congress, and here I would like to express my gratitude to our member organization, La Unió, and we have been able to make it, and finally we're here. So it is my great pleasure to see so many of you here attending, and I wish you a very good Congress here in the beautiful city of Barcelona. So very warmly welcome.
Thank you very much, Dr. Miettunen. As we mentioned, this is a key event worldwide that for 4 days places Barcelona and Catalunya as benchmarks in health. This forum represents a unique opportunity to show Catalan healthcare to the world and sharing learnings and advance in the best care for people from the 5 continents. That's why the most honorable Mr. Pere Aragonès, President of the Generalitat de Catalunya, wanted to be present with us. Although he cannot be here today because it coincides with the government sessions to approve the draft budget for 2022, he wanted to send us his recorded message.
Good morning. As President of the Generalitat de Catalunya, it's an honor to be able to greet you at the beginning of the 44th World Hospital Congress that is taking place in Barcelona. We are very excited that the Catalan capital will host the first World Congress of its kind to be held after the pandemic. I must thank the Catalan Union of Hospitals and the International Hospital Federation for organizing a much-needed Congress with health officials and health organizations from the 5 continents. Bon dia a totes i a tots. Com deia, és un honor que Barcelona aculli el 44è World Hospital Congress, la primera trobada d'aquestes característiques després de la Covid-19. Justament, amb la pandèmia hem vist la necessitat d'una resposta global i coordinada per protegir la salut de les persones. Hem repetit desenes de vegades que només aconseguirem superar definitivament aquesta pandèmia quan tothom estigui vacunat. I aquest tothom s'ha d'entendre en el seu sentit més ampli i transfronterer, com estic convençut que sabrem fer en el marc del present Congrés. De la mateixa manera, un altre dels aprenentatges derivats de la Covid-19 ha estat la importància de transformar els sistemes de salut per millorar l'atenció a les persones i donar resposta a nous reptes. El sistema sanitari català va saber estar a l'alçada i aprofito aquesta ocasió per agrair novament al conjunt de professionals que ho han fet possible. Durant tots aquests mesos s'ha evidenciat més que mai que un sistema de salut fort és imprescindible per garantir la igualtat de drets de tothom, tant per donar cobertura a aquelles persones que han patit la Covid en primera persona, com aquelles altres que tenien altres tipus de patologies i que calia continuar atenent-les. Per això és urgent recuperar l'equitat en l'accés en el sistema de salut des d'una visió transformadora i de futur. Hem de recuperar la capacitat diagnòstica de certes malalties com poden ser el càncer o les malalties degeneratives i hem d'integrar també nous models d'atenció per millorar l'accessibilitat, la seguretat i la personalització a través, per exemple, d'una salut digital que complementi el contacte presencial entre professional sanitari i usuari. En aquest replantejament del sistema sanitari, en aquesta transformació per fer-lo capaç de respondre a totes les necessitats actuals, és imprescindible també centrar-nos en la salut mental. No podem pensar un sistema sanitari integral sense abordar tots els aspectes relacionats amb la salut mental i emocional. Finalment, cal donar resposta als problemes crònics no resolts dels sistemes de salut que la pandèmia ha fet aflorar. I aquí hem de parlar de la necessitat d'adequació de les competències i dels rols dels professionals, la necessària interacció dels serveis sanitaris amb els serveis socials i, per últim, però no menys important, de la històrica insuficiència pressupostària que condiciona el conjunt del servei. Invertir en salut és invertir en el benestar de la ciutadania i no hem de poder trobar cap excusa per no fer-ho. Això em porta a un últim repte: reforçar els sistemes de prevenció d'acompanyament de les persones. Cal invertir en promoció i en educació per a la salut, de manera preventiva i amb una escolta activa de les decisions del pacient. I alhora cal incorporar la salut en totes les polítiques del país, en l'educació, en el medi ambient, en el treball, en l'habitatge, en la mobilitat i en les infraestructures. La salut és una qüestió transversal i fonamental i cal atendre-la i abordar-la com es mereix. Per això estic convençut que les conclusions que es derivin del Congrés que avui comença seran molt útils per millorar la vida de les persones, que és, sens dubte, un objectiu compartit per tots els que avui sou aquí. Moltes gràcies.
Thank you very much, Mr. Aragonès. Well, now it's time to move on to the last video that will end the institutional part of this opening ceremony.
The global COVID-19 pandemic has turned all the healthcare systems upside down. All healthcare professionals have faced extreme situations of fear, upset, patient care pressure, and uncertainty. But in the healthcare system, we were able to respond. We have worked as a team more than ever, promoting shared decisions, conserving humanism in management, and in the care of people. In Barcelona, in Catalonia, today, we inaugurate the 44th World Hospital Congress. From the 8th to the 11th of November, an opportunity to learn, share, and exchange knowledge, and together transform our healthcare systems. To provide a fast, effective response tailored to the needs of each person. Over 4 days, more than 1,500 professionals from all over the world will debate and share solutions in this Congress, the first worldwide Congress since this pandemic. We must learn from the healthcare crisis to be able to transform and change. The hybrid format of the Congress will allow us to reach the entire world with a scientific program with international experts, which will deal with the innovations to recover and rebuild from the pandemic. A congress with debates on accelerating research and distribution of the COVID-19 vaccine, with tables for reflecting on humanizing technology in comprehensive care services, with spaces for sharing visions on ethical or female leadership and nursing leadership to transform healthcare systems. A congress with visits to benchmark hospitals and healthcare institutions of the Catalan healthcare system, with a marketplace, an innovation hub of companies, with a solidarity concert in El Palau de la Música Catalana to provide support for the telethon La Marató de TV3, dedicated to research on mental illness. A congress of the International Hospital Federation and the Unió Catalana d'Hospitals. We are making Barcelona the world health capital. We are making Catalonia the focus of international attention. We are taking a leap forward for change and for the transformation of our healthcare systems, to make ourselves more accessible, more agile, and more sustainable. We think about people, and today we are building a new future with an outlook open to the world, transforming healthcare by blending agility, responsiveness, and resilience.
Well, so now, once the institutional part of the ceremony is over, I would like to ask to the members of the table, the mayor and all the representatives of the entities, if you could take your place here downstairs on the first row. Thank you very much for your presence here on the stage. And I would like to ask the members of the next to up on stage. So please, Dr. Trilla, Mr. Grifols, Dr. Klug, if you don't mind, you can go up here on the stage and take your seats on the table. Thank you very much. Thank you and welcome on stage. As I said, it's time to continue with the inaugural ceremony of this 44th World Hospital Congress, a congress characterized by scientific excellence, having a program with the world's leading experts in health system and with the main countries' knowledge partners, and the innovation from the collaboration with the business world. And that's the reason why exists a marketplace with more than 20 companies that are presenting innovative solutions. We are honored, as I told you before, to be joined by Dr. Antoni Trilla, President of the Scientific Committee, Mr. Víctor Grifols, main sponsor and co-CEO of Grifols, and Dr. Hans Klug, World Health Organization European Regional Director. First of all, Dr. Trilla will offer us a few words. Dr. Trilla is a professor of public health at the University of Barcelona, head of the Preventive Medicine and Epidemiology Service at Hospital Clinic Barcelona, and Dean of the Faculty of Medicine and Health Sciences at University of Barcelona. He is a research professor at ISG Global, where his group researches vaccines, emerging diseases, and epidemics. He is also an elected academician of the Royal Academy of Medicine of Catalonia. And during the pandemic of COVID-19, Dr. Trilla has been a reference for the country authorities, but also for the citizen with his public interventions. So please, Dr. Trilla, it's so kind.
Bon dia, autoritats, membres de la EXcma, congressistes presents i congressistes online. The 44th World Hospital Congress is ready to start now in Barcelona. I would like to thank the members of the Scientific Committee for the work they have done in order to guarantee that the content of all scientific sessions will be, without doubt, of the highest possible quality standards. We are quite confident that the presentations, the roundtables, and the discussions will be of interest for all of you. The exchange of scientific information is, today more than ever, of paramount importance. Make no mistake. In these difficult times of the COVID-19 pandemic, three things have been the key to move us forward and put us in a closer position to achieve its functional control. First of all, we, the people with extraordinary solidarity which has so sustained the pandemic response. People who follow the rules and restrictions required to keep us safe and also to allow health systems to work properly. Second, the healthcare professionals, all of them, all of you. We work together as a team, making difficult decisions, innovating and creating new ways of delivering healthcare in the midst of a public health crisis. We don't give up. We never give up. Many lives have been so saved. Third, the science with capital letters. In a world where denialism is growing elsewhere and in the middle of an infodemic, science has brought forward in a record time safe and effective vaccines against COVID-19, and new treatments will follow soon. This is a huge achievement. More than 1,000 communications will be presented here by professionals from all over the world. More than 1,500 attendees, online or here, are ready to listen and challenge new ideas as well as to find new solutions together. I would like to acknowledge the outstanding work done by the organizers, Unió Catalana d'Hospitals, in order to make this meeting possible. I work in a public large teaching university hospital, the Hospital Clínic of Barcelona, since long time ago, a past time called the 80s. A hospital is a living thing. It gathers patients, people, and professionals. It gathers the best of healthcare, research, teaching, and learning. Now is the right time to strengthen, reshape, reorganize, and support the hospital system as well as the healthcare system itself. Remember, we have one world and one health. Finally, and although we grumble sometimes, we all love Barcelona. I'm quite sure you will also fall in love with our city. In the meantime, please enjoy the 44th World Hospital Congress. Moltes gràcies i benvinguts a Barcelona.
Thank you very much for your words, Dr. Trilla. Now, turn to Mr. Víctor Grifols, co-CEO at Grifols and main partner of this Congress. Grifols is a global company in the health sector that since 1909 improves the health and well-being of people around the world. Grifols commercializes his products in more than 100 countries. Leader producing plasma-derived drugs and transfusion medicine, and its business is organized into 4 divisions, always characterized by quality, safety, and innovations. These 4 divisions are bioscience, diagnostics, hospitals, and biosupplies. Since 2017, the year in which La Unió presented its candidacy to host the 44th World Hospital Congress, its support to make it a reality has been a key for this event. So, Mr. Grifols, whenever you want, the word is yours. Thank you.
Thank you. Bon dia, molt benvinguts a tothom. Welcome and greetings, Mr. President, Mayor of Barcelona, members that have made possible this event, this Congress, and rest of attendees to this session today. Grifols is honored and delighted to be supporting as main partner this IH Barcelona 44th World Congress of Hospitals. We're especially delighted for 2 main reasons. First one, it's because it's held in our city where the company was born in 1909. And second, because here is as well in Barcelona, where precisely the plasmapheresis was invented my great uncle, Josep Antoni Grifols i Lucas, in the year 1951. And this year, if you count precisely, it's the year where we are celebrating the 70th anniversary of the invention of the plasmapheresis. Plasmapheresis was a revolutionary innovation that paved the way for an entire industry of blood and plasma-derived medicines that after 70 years, as I said, is still evolving in new therapies as a consequence of continuous research and innovation in the industry. Probably there is very little medicines that after 70 years still are being evolved. And this is the case for the plasma medicines. And all is based in the discovery and understanding of the roles that the proteins present in our plasma play in our physiology. When plasmapheresis was performed for the first time, back in the year 1951, only one protein was known. This was the case of albumin. During the 80s and 90s, it was known that around 300 proteins were present in plasma. 10 years ago, it was discovered that not only 300, but 3,000 proteins were present in plasma. And nowadays, in the year 2021, we know that there are present in plasma more than 9,000 proteins. And if they are here in our body, going up and down 90,000 times per day, it's because they play a role in our physiology. Well, with the plasma industry, and us in particular, we have been very active in the discovery of what role these proteins play. So we are doing great research and understanding the role of these 9,000 proteins. As I said, especially now we are focused to understand what their role they play in the course of our lives, understanding the correlation with diseases, with the presence or absence of those proteins in our plasma as we get old. And now we are really focused on that. And I encourage you or recommend you, if you can, I think it's on Wednesday, we will hold 2 sessions that will talk about this concept of aging related to plasma and neurodegenerative diseases related to plasma as well. But what continues to be a challenge for us in the industry, the ones that are focused on this plasma industry, is and has always been the access to this raw material, to plasma. And this situation with COVID-19 has nothing but been exacerbated, arriving to a point today, and this is real, where the industry, we globally are not able to supply all the medicines that our patients need. And in many, many cases, those medicines that come from plasma products are life-saving medicines for our patients. So really, for them, being a patient nowadays that rely on those proteins, on those medicines, sometimes may be a real drama for them and their families. So my ask here is like in COVID, and Dr. Trilla was saying, and in the president in his video, the only way to solve this real issue with access to plasma is like COVID, when everybody works as a team, private industry, public organizations, public and private hospitals, healthcare providers, and governments. So here the ask from the industry, and now in the name of Grifols, is that the message is that we need to find a way to cooperate to try to mitigate this lack of plasma that nowadays is in the world. And that's all from my scientific speech. Welcome to Barcelona, and I hope that you enjoy the Congress and the city.
Thank you very much, Mr. Grifols, for your words. Now it's time to continue with Dr. Hans Klug, who began as a regional director of the World Health Organization in Europe on February 2020 and has 25 years of experience in medical practice in public health worldwide. He's a graduate in medicine, surgery, and obstetrics from the Catholic University of Leuven in 1994 and has begun his career as a family doctor in Belgium. He gained international experience attending emergencies in Liberia, Somalia, Siberia, as a member of Médecins Sans Frontières, coordinating a tuberculosis control program. Dr. Klug joined the World Health Organization in 1999 as a project director in the Russian Federation. But in 2009, Dr. Klug moved to the regional office for Europe. The following year, he was appointed director of the Division of Health Systems and Public Health. As a director of the division, he worked for a global care and worked for the health system reforms with the European Commission, the Organization for Economic Cooperation and Development, the World Bank, and the Global Fund to fight AIDS, tuberculosis, and malaria. Dr. Klug, thank you very much for being here, and the floor is yours.
Dear Madam Mayor Ada Colau, President Dr. Trilla, President Risto Miettunen, incoming President Deborah Bowen, dear friends and colleagues, buen dia. I want to start by paying tribute to the health and care workers, the many hospital managers present today, those of you delivering health alongside your staff. I want to ask you to convey, on behalf of the World Health Organization, a message of gratitude, respect and support to all the teams you lead and their families for the commitment, altruism and resilience you have all shown in the past 2 years. The WHO European region covers 53 countries, many of which I have visited during the pandemic. Every single time, I have been in awe of health workers' professionalism and heroism on the COVID-19's front line. These people will continue to be on the front line because we are in for a tough winter. Currently, every single country in Europe and Central Asia is facing a real threat of COVID-19 resurgence or already fighting it. Once again, our region is the epicenter of the pandemic, with growing transmission, hospitalization and deaths. There have been 2 million cases reported over the past week, and most tragically, close to 1.5 million people have lost their lives due to this virus. The good news is that we can take measures to avert the projected deaths based on the lessons we have learned. That requires all of us to keep battling with COVID-19 while striving to not fall further behind with the routine service delivery. At this point in time, it is of the greatest importance that every health worker across the region is fully vaccinated. The same urgency applies to vaccinating the public. Most of those hospitalized and dying from COVID-19 are not fully vaccinated. And even though 80% of the health workers in the region have completed a full vaccination series based on data from 33 countries, the uptake is uneven. Worryingly, there are still several countries where less than 20% of health workers have been vaccinated. It is equally important that preventive measures are put in place by national authorities and the public. These are measures that work, enable lives to continue, and keep the virus at bay. These two tools, extensive vaccination and preventive measures, are the only way of easing the growing pressure on health services and hospitals on the front line. 1 year, 9 months and 19 days since the first COVID-19 cases in Europe, what have we learned? First, well-run, coordinated health systems are key. Hospitals can only perform optimally if embedded in health systems with strong primary health, community, and social care that together function to place people's needs and expectations at the center. The key words here are strong primary healthcare. This has been underlined in the pandemic time and time again. To take note, the time for doing this is before a crisis hit, not during. Second, investing in appropriate modern hospital infrastructure to deliver high-quality care is vital. Many health systems entered the pandemic unprepared, with insufficient hospital and intensive care unit capacity, creating huge challenges when hospitals were inundated by one wave after the other. This, to a large extent, is the result of a down-prioritizing and consistent underfunding of health facilities. But infrastructure alone is not enough unless we are laser-focused on the quality of the care we deliver and ensuring patient safety. Here in the WHO European region, we have established a new Centre on Quality of Care and Patient Safety with the generous support of the Greek government. Our first meeting will take place on the 2nd and the 3rd of December, and we have invited all regions globally to participate. Third lesson. One cannot respond to the greatest health crisis of our times with an insufficient health workforce. In a short time, new hospital wings were equipped, ventilators purchased, but what then became a bottleneck was staff numbers. 2 out of 10 health workers have suffered mental health symptoms and burnout. They have been under an enormous strain and continue to be, often in unacceptable circumstances. We need to invest in our workforce, and we need to nurture and protect it. We need to create an enabling environment, particularly for women, as we heard from Madame Mayer, for women to be able to advance their career in this profession. Health workers need to feel valued. Working in health must be made more attractive. By doing so, we also work to improve gender inequities, bearing in mind that 70% of the health workforce is women. We achieve that through better pay, better workplace, and better training, so that our health and care workers feel physically and mentally safe. In this regard, your role as hospital managers is of the utmost importance. Fourth, the future of health is digital. The accelerated digitalization of health systems that we have seen during the pandemic was timely. It is no coincidence that properly digitized hospitals and systems have provided a clear advantage in the pandemic. We have now entered a new era where governments are keen to invest in digital infrastructures, systems, artificial intelligence and robotics, where computer science, engineering, and health meet each other. Digitalization is an opportunity to develop consistent and interoperable health services, nationally and globally. Digitalization means better health services. Huge steps have been taken in recent months, but for that to continue, we need your support. And what is more, we need you to articulate your needs so that investment is aligned with resolving real day-to-day challenges. Now let me turn to outline what the WHO Regional Office for Europe is doing to make all of this happening. First, a year ago, I established the independent Pan-European Commission on Health and Sustainable Development, chaired by Professor Mario Monti, former Prime Minister and Minister of Finance and European Commissioner in Italy, tasked to rethink policy priorities based on the lessons from the pandemic. what features heavily in the Commission's final report is the need to learn the lessons from the last financial crisis, and that now it is the time to invest in health and One Health. One of the Commission's main recommendations on global governance was picked up only days ago when the G20 in Rome launched a task force to put financial firepower into tackling health crises, a direct outcome of the Monti Commission. Second, last week we issued a report with new evidence on financial protection in Spain's health system. The report illustrates the extent to which the 2008 crisis impacted the health sector and the actions that have been taken in recent years to strengthen how a health system protects people from financial hardship due to out-of-pocket payments. That is one way of closing inequality gaps, something the Pan-European Commission on Health and Sustainable Development has called for. COVID-19 has brought financial protection to the fore, and Spain here is a leading example, including, among others, migrants into the universal health coverage package. WHO will continue putting financial protection on the agenda until the inequality gaps are closed. Third, next month on the 14th and 15th of December, WHO, with the support of the European Observatory on Health Systems and Policies, that has recently published a volume on the changing role of hospitals, is convening a first exploratory meeting of hospital experts to determine how pandemic lessons are taken forward in designing and operating hospitals. On this, we trust we can rely on the support of the International Hospital Federation as a partner. WHO aims to have technical guidance ready next year to support investments in hospitals, ensuring that such investments are effective and sustainable. Fourth, we established the Oslo Medicines Initiative with the goal of improving access to effective, novel, high-priced medicines, putting into action a new vision for collaboration between the public and the private sector. A key reason behind developing this initiative is to address the pressure novel medicine and therapeutics are putting on hospital budgets. If we succeed, we will have for the first time a new social contract with the industry that we hope to present mid-June 2022 at a political high-level meeting in Oslo, Norway. And fifth, we are working interregionally across the globe with other WHO regional offices to address health workforce migration, something that became even more prominent during the pandemic, when a number of countries rushed to address domestic gaps through international recruitment. Our end goal is sustainable, ethical recruitment processes that benefit health workers, patients, health systems, and economies. Next year, we'll be organizing an interregional political meeting in Istanbul, Turkey, to bring a new narrative on migrant health, including the health of migrant workers. Finally, I would like to draw your attention to the guiding principles of the WHO European Programme of Work 2020-2025 that guides our work and that all our 53 member states have committed to. The tagline of this programme of work is United Action for Better Health. But this is more than a tagline. It is the bedrock of what we do, working together, working with you to improve the health and well-being of the almost 1 billion people we serve in Europe and Central Asia. The road ahead, my friends, is arduous. But in the past 2 years, we have seen what can be achieved and what we are capable of when working together with partners such as the International Hospital Federation. This health crisis, like all crises, bring about change. We, WHO and the International Hospital Federation, are part of that change. And we intend to make the most of the many windows of opportunity, to usher hospitals into a new era of digital, high-tech, green quality services delivered with warmth and care. More than once, the society in Europe has undergone fundamental transformations in extraordinary times, serving as an example for the rest of the world, to build back better forward based on the values of solidarity and equity. These successful societal transformations were each time built on 4 ingredients. 3 of the 4 we have: necessity, innovation, cooperation. And now we need the 4th, courage. Thank you.
Thank you very much, Dr. Klug, and also, of course, Dr. Trilla and Mr. Grifols for your previous intervention. Now let's proceed to the opening plenary session. That's why I would like to ask you to go downstairs, please, and take your seats here at the front row. Thank you very much again for all your words. Thank you. Thank you.